Hello everyone, welcome back to the channel. Today we are going to talk about an important skin condition called scabies. It's a topic that might make you feel a little uneasy, but it's crucial to understand because it's highly contagious. The good news is it's completely treatable, especially when you catch it early. Unfortunately, many people don't recognize the signs, which can lead to prolonged discomfort and accidentally spreading the infection to family and friends. So, in this video, we're going to dive deep into the 10 common signs of scabies to help you identify it and get the right help. First, let's quickly cover what scabies actually is. Scabies is a skin infestation caused by a tiny 8-legged mite called Sarcoptes, Scabies. These mites are so small you can't see them with the naked eye. They burrow into the top layer of your skin to live and lay their eggs. This burrowing action and the body's allergic reaction to the mites, their eggs, and their waste is what causes the main symptoms. Scabies can spread very easily through close, prolonged skin-to-skin contact with someone who has it. It can also spread, though less commonly, by sharing personal items like clothing, bedding, or towels with an infected person. It's important to know that anyone can get scabies, regardless of their age, gender, or personal hygiene habits. Early recognition is absolutely key to stopping its spread and getting effective treatment. All right, let's get into the first and most well-known sign of scabies: intense itching, especially at night. This isn't just a mild occasional itch. People with scabies describe it as a relentless, overwhelming urge to scratch that significantly worsens in the evening and overnight. Why at night? It's thought that the mites become more active when the body is warm and still in bed. This intense itching, medically known as pruritus, is the body's allergic response to the presence of the mites. You might find yourself scratching so much that your skin becomes raw, sore, and inflamed, which can sometimes make it hard to sleep. If you're re-experiencing an itch that just won't quit and seems to ramp up after the sun goes down, scabies should be on your radar. The second sign to look for is a distinctive rash. The rash associated with scabies often looks like little red bumps, similar to pimples, hives, or tiny insect bites. At first, the rash might be very small and localized, but it can spread over several days or weeks as the mite population grows and moves to new areas of the skin. This rash is a direct result of the body's inflammatory reaction to the mites burrowing beneath the surface. It can appear anywhere on the body, but is most commonly found in the specific areas we'll discuss in a bit. It's easy to mistake this rash for other skin conditions like eczema or dermatitis, which is why looking for the combination of signs is so important for a correct identification. Sign number 3 is one of the most classic indicators of scabies: small burrow tracks on the skin. These are tiny, thread-like lines that the female mites create as they tunnel under your skin to lay their eggs. The burrows can be very subtle and hard to see. They often appear as grayish, whitish, or skin-colored raised lines, sometimes just a few millimeters to a centimeter long. You might see a tiny dark speck at one end of the burrow, which is the mite itself. These tracks are most frequently found in areas with thin skin, like the webbing between your fingers and toes, the folds of your wrists, or on your elbows. Finding these burrows is a very strong clue that you're dealing with scabies and not another skin issue. A doctor might use a special ink test or a magnifying tool to make them more visible during an examination. Moving on to sign number 4, the presence of sores, scabs, or crusts on the skin. These develop as a direct consequence of the intense itching. When you scratch relentlessly, you can break the skin, leading to open sores. Over time, these sores can get covered with scabs or crusts as the body tries to heal. These secondary lesions can sometimes obscure the original rash or burrows, making diagnosis a bit more tricky. Moreover, these open sores create a gateway for bacteria to enter, which brings us to another potential complication. If you notice scabs forming over itchy areas, It's a sign that the condition has been present for a little while, and that your skin is being damaged by the scratching. Sign number 5 is thickened or scaly skin. This symptom typically appears in more severe or long-standing cases of scabies. If the infestation is not treated for a prolonged period, the constant irritation, scratching, and inflammation can cause the skin to become thick, leathery, and scaly. This is especially common in a severe form of scabies, known as crusted scabies or Norwegian scabies. In crusted scabies, an individual can have thousands or even millions of mites, leading to widespread, thick crusts on the skin that are highly contagious. This form is more common in people with weakened immune systems, the elderly, or those with certain medical conditions. If you notice any areas of your skin becoming thick and scaly, it's a definite signal to seek medical attention right away. The 6th sign we'll discuss is the appearance of small blisters. While the typical scabies rash is bumpy and pimple-like, sometimes small fluid-filled blisters, also known as vesicles, can form. This is particularly common in infants and young children who get scabies. These blisters are usually very itchy and red, and they can easily be confused with other childhood skin conditions like chickenpox or impetigo. The blisters are another form of the body's inflammatory response to the mites. Seeing blisters, along with intense nighttime itching, should raise suspicion for scabies, especially in a young child. Sign number 7 focuses on a very specific location: skin lesions between the fingers and toes. The mites that cause scabies have a preference for certain areas of the body, and the webbing between the digits is a prime spot. The skin here is thin and protected, making it an ideal environment for the mites to burrow and lay their eggs. So, if you're experiencing symptoms, take a close look at the spaces between your fingers and toes. You're likely to find the characteristic red bumps, rash, or even the tiny burrow tracks in these areas. This specific location is one of the hallmark signs that dermatologists look for when diagnosing scabies. This brings us to sign number 8, which is the typical distribution pattern of the rash on the body. Besides the fingers and toes, scabies, mites, love warm, folded areas of skin. The rash commonly appears on the wrists, especially the inner part, the elbows, the armpits, around the waistline and belt line, on the nipples for women, and on the genitals for men. In children, the rash can be more widespread and may also appear on the face, scalp, neck, and the palms of the hands and soles of the feet. Recognizing this pattern of where the rash is showing up can be a huge help in distinguishing scabies from other skin conditions that might have a different distribution. Sign number 9 is the development of secondary bacterial infections. As we mentioned earlier, the constant and intense scratching breaks the skin's protective barrier. This makes it easy for bacteria, like Staphylococcus or Streptococcus, to get in and cause an infection. Signs of a secondary infection include increased redness, swelling, pain, warmth in the affected area, or the presence of pus or yellowish fluid oozing from the sores. If a skin infection develops, it can become quite serious and may require treatment with antibiotics in addition to the treatment for scabies itself. So, if your itchy rash starts to look infected, it's very important to see a healthcare professional without delay. Finally, sign number 10 is the spreading of symptoms to close contacts. Scabies is highly contagious. If you have it, it's very likely that people you have close physical contact with will also get it. This includes family members, partners, or roommates. Typically, symptoms appear in new contacts about 2 to 6 weeks after their initial exposure. So, if you're re-experiencing these signs, and you learn that a family member or partner has also started to develop a mysterious itchy rash, it is a very strong indicator that scabies is the culprit. This is also why, when one person is diagnosed, it's usually recommended that the entire household and close contacts get treated at the same time to prevent reinfestation. So, to quickly summarize, the 10 common signs of scabies are: Intense itching, especially at night, a red bumpy rash. Small burrow tracks on the skin, sores, scabs, or crusts from scratching. Thickened or scaly skin in severe cases. Small blisters, especially in children. Lesions specifically between the fingers and toes. A rash on the wrists, elbows, armpits, waist, or genitals. Secondary bacterial infections. And the spreading of symptoms to close contacts. Remember, while scabies can be extremely uncomfortable and distressing, it is treatable. If you suspect you have scabies based on these signs, it's crucial to see a doctor or a dermatologist for a proper diagnosis. They can confirm the infestation and prescribe medicated creams or oral medications that will kill the mites and their eggs effectively. It's also vital to wash all clothing, bedding, and towels in hot water to eliminate any mites and prevent the infection from coming back or spreading to others. If you are struggling, please remember that getting scabies is not a reflection of your personal hygiene, and there's no shame in seeking help. Early detection and treatment are the best way to get relief and protect those around you. We hope this video was helpful in shedding some light on this common condition. If you found this information valuable, please give this video a thumbs up, share it with anyone who might benefit, and don't forget to subscribe to our channel for more health content. Thank you so much for watching, and stay healthy.